I'm Jennifer Clare. I'm the professor for this little mini course, Cancer 101. I want to thank you for taking the time to be here. I've had many clients, friends, family ask me to do something that those affected by cancer could look at and review in the privacy of their own home without everybody breathing down their neck. I am a straight shooter and I will tell you like it is. I hope that this will be informational, helpful, and simple. People think they understand about cancer, but not specifically or tailor fit to their own specific needs. And that's what I'm attempting to do here. So bear with me. And again, I welcome you to this little mini course, Cancer 101. And you will get my contact information. If there's anything you need ever, you just let me know. Thank you. Thanks again for being here. Now I'm going to talk a little bit about the agenda. I want everybody to understand that the reason I even got into this is because in August of 2022, my best friend of 40 years was diagnosed with colorectal cancer. It was stage 3B. She did not have a deadly diagnosis, but she certainly did not have a good one. And having been in the medical field since I was 18 years old, I thought I knew a lot. And then I found out there was a lot I did not know. Most of my life, I worked in OBGYN, which I really, really loved. And I was very much drawn to the life of pregnancy and babies. And if somebody had said the word cancer to me when I was younger, I would have run the other way as fast as I could. Because to me, when I heard the word cancer back then, I heard death, not life. I didn't understand that due to my best friend's journey and everything that we went through, that my life then would be directed towards helping cancer patients live. So my views on life and death have changed drastically. Cancer does not have to be a death sentence. The medical technology is amazing and it continues to be, but people aren't told those kinds of things. So I do want you to know, I think it's important to cover all the aspects of a cancer journey. So I want to talk about the diagnosis, the amount of confusion that happens. There's a lot of different emotions. You will get blasts of information from everybody telling you what to do, where to go, who to see, what, blah, blah. It's highly overwhelming. We need to talk a little bit about doctor visits, what you're dealing with specifically, not everybody, but you personally. And then I'm going to get into integrative medicine, which is kind of where I specialize. And more than anything, I think the point of that is for you to know that you have options and it's not what you think. So that's going to be our agenda. It's very important that you understand you need to untrain your mind to everything that you've been taught when it comes to medicine and cancer. So generally speaking, I believe that when we hear cancer, we automatically go into panic mode, and then we hear chemo radiation. That's kind of all we hear. The truth is that's very archaic. It's very non-productive. It will not heal you. It will not cure you. And I'll get into that more later. But I want you guys to understand you have options. And I am not an advocate for chemo and radiation whatsoever. So if you want to stop the class now, you can. But I am here to tell you that you have numerous options, not just chemo and radiation. So thank you. I hope you're open. I hope that all of this is going to be helpful, and hang on because we're going to dive in. Okay, so let's talk about a diagnosis and cells. When somebody gets told you've got cancer, their minds go to a million different scenarios. What happened? Why did this happen? What is it? Where did it come from? What did I do? All these different things. The truth is, no matter what type of cancer somebody is diagnosed with, it means that your cells have just gone haywire, okay? There's a whole technical process to it, but again, I want to break this down and make this very, very simple for people. So, our cells are the smallest, tiniest unit that can live on its own, and it makes up all living organisms and all of the tissue in the body. We have lots of different kinds of cells. So, I always tease about this too because, you know, we have muscle cells, nerve cells, reproductive cells, fat cells, and I always say fat cells are the worst. Anyway, each cell in your body has three main parts, okay? It has the cell membrane, the nucleus, and the cytoplasm. Now, do you need to know what that means? No, don't even worry about it. Just understand I'm giving you the body of the cell. Inside of each cell, there's a whole bunch of stuff going on, and I mean a whole bunch of stuff all the time. The inside of your cell, the nucleus, is where you're going to see the DNA. And again, this is not scientific. I am not reading from a medical book. I am trying to give people the most simplest, cut and dry, just so you can kind of get a bigger picture type thing. This is not a nursing class. Okay, so we have tumor cells. We have killer cells that help destroy bad cells. And we have tumor cells. So a tumor cell, if it goes bad, it's malignant, which means cancer. If it's benign, it means non-cancerous. I think most people understand this. I always think about, you know, a fatty bump on our pet's paws or something like that as being benign. It might be a pain in the butt, but it's benign. So all of us have good cells and bad cells. The good cells see the bad cells, they recognize them, and they go after them. We have white blood cells and red blood cells and all these different kinds of cells. Well, if something goes haywire and there's a mutation, the good cell no longer sees the bad cell. And then that cell stays bad, multiplies, grows. That is what cancer is. So it's really a cluster of a bunch of cells that were bad for some reason. We'll get into that later. And they have not been destroyed. Now they're going out of control. So now you've got the cancer in the cell, uncontrolled cell growth. So what do we do to fix that? So this slide talks a little bit about what I just mentioned previously. Inside of each cell, you have DNA. And inside of that DNA, you've got chromosomes. On the chromosomes, you have genes. No, this is nothing we can see, which we all know. So if you look at this slide, you have a strand of, let me get you a pointer. This is what DNA looks like. And inside of this DNA, there are lots of codes. And again, this is not scientific. This is simple 101. These little things over here, these little squiggly suckers, that's your chromosome. So we all have our chromosomes. And then we have genes that are in our chromosomes. So inside of the DNA, there will be a problem. If you look here at this one in the upper right corner, excuse me, see how there's something broken here? Now, that is going to contribute to cancer and lots of other health-related issues as well, but we don't always know why. Sometimes it's the environment. Sometimes it's the food we eat, smoking, lack of exercise. There's lots of different reasons. It could be your metabolic state. You have too much acid, not enough acid. Low oxygen environments tend to produce cancer more often. High sugar, all these kinds of things. There are lots of things that contribute to cancer. And of course, we don't know everything. But one thing for sure is that when your DNA is supposed to look like this and everything's working right, okay, and all these little guys down here, they're all doing what they're supposed to be doing, but then something goes haywire and the good cells can't see it. This happens. So this is called a mutation. When you have a mutation in a gene, this happens, this white squirrely looking little thing. Your cells don't exactly know what to do. And then you've got, like I said, this uncontrolled cell division, and it starts to take over. When this happens, the good cells can't do their jobs. The problem is, and this is the way I explained it to my best friend, and again, nobody come at me with, that's not scientific. I'm admitting it. If anybody saw the movie Independence Day with Will Smith, and I've had people say, I hate Will Smith. I'm like, I don't know. It's just a movie. The movie part is good. If you've seen that movie, they have a mothership, right? The mothership here. And then there's all these little baby ships. And they're thinking, how do we blow this thing up? How do we get rid of it? So they decide that they're going to go shoot at all these little baby ships. Well, the problem is once they get there, they all have shields covering them. And then they're like, oh no, what do we do? How are we going to do this? And they said, well, if we kill the mothership, maybe all the baby ships will die. And they're like, yeah, except for the mothership has a shield too. How are we supposed to blast through this shield? Like, how do we do that? They finally figure out they need to go inside of the mothership and blow it up from the inside out. That is a great analogy of cancer. So, for example, you have a good cell and you have a bad cell, and the bad cell finds a way to be sneaky and it covers itself with a shield. And the good ship, it doesn't see the bad cell now because it's covered. So the good cell just goes away. It just goes away and leaves it alone. And the bad cell's like, boom. And then it starts multiplying and growing. And the good cells don't even recognize that. So if you were to take chemo, it might kill some of those bad cells, but it also kills all of the good cells. So now the good cells aren't keeping your body healthy. And that is why now we have treatment options and things that can be done. Regina had specific targeted treatments just for her, which I will get into. And hopefully this will enable you to get the right, perfect treatment so that your body can go into the bad cells, blow the suckers up, and then retrain the good cells how to recognize the bad ones. Hi. Okay, now we're going to talk about emotions. I think this is one of the worst parts, meaning there's so many overwhelming emotions. So when it was my best friend Regina, we have lived together and shared a house for about 25 years, but we've been best friends almost 40 years. And I always tease and say, you know, the only way you get two women to live in the same house is we have our own wings, right? One room that way, one room that way. Anyway, in July of 2022, she woke me up at about 4 a.m. and she said, Jenny, and I knew something was wrong, and I jumped out of bed and I said, oh my God, what's wrong, what's wrong, what's wrong? She said, I just filled a toilet with blood. And I was like, what? And I'm like a little or like a bowl? And she's like, no, like a bowl. And I'm like, you need a colonoscopy. And she said, I had one like 5 years ago. And I said, I know, but like that's not normal. So I said, okay, let's see how you do in the next couple hours. And if you're like hemorrhaging or something, we're just going to the emergency room, but something's not right. So it actually slowed down, which was good. But I said, I still want you to get a colonoscopy. And she's like, oh my God, don't make me go do that. I mean, like, who wants to do colonoscopies, right? It's not a lot of fun. But I said, you're doing it. So I took her August 8th. And so we had to wait about 3 weeks to get in. Excuse me. We were a little worried, but not the end of the world type thing. In the midst of this, Regina's sister was in a hospital in another state, and Regina couldn't get to her. She had back problems. She had pinched nerves. Her sister didn't want anybody to see her in the hospital, those kinds of things. And August 2nd, we got the call that Regina's sister had passed away. My birthday was a couple days later, and we did have a beautiful day, and my daughter made sure of that, as she always does. But then the colonoscopy was August 8th, so we went in. Well, if you've ever been there for somebody coming out of a routine colonoscopy, you know, they make you wait for a little while your person's kind of coming back into reality. And so I was just kind of standing there waiting, and I saw the doctor walking down the hall, and I smiled big, but he didn't smile back. And I thought, oh crap, that's not good. I mean, he like really did not even smile. And the look on his face was kind of like, I'm not sure I really want to talk to you, you know? So he waved me on, and I went over to where Regina's bed was, where she was laying in recovery, and she was still kind of out of it. And he said, well, I'm just going to be honest. I don't have good news. You have a very large tumor in your rectum, and it's definitely cancer. I mean, we're doing a biopsy, but, and I was like, oh my God. So Regina's like, what? She's still, you know, groggy. And I said, you have a tumor. And she's like, what does that mean? And I said, it means we have a very long road ahead of us. And it's still hard to talk about. I was kind of like, did that just happen? So the doctor told me, get to a specialist. Do not like wait, go. And okay. But we are beholden to, in America, the health insurance companies, pre-authorizations, all those kinds of things. So once I got Regina to the car, she said, is this really happening? And I'm like, yeah. And she said, why in my butt? Like, the reason I'm telling everybody this is because once you hear the word cancer, you kind of just don't care anymore. It doesn't matter if it's your butt, your boob, your brain, your leg. It's bad. It's just bad. And then you go through all of these emotions of being sad and scared and then angry. And, you know, we had so many things that we loved to do. And I know this is going to sound funny, but it's just real and accurate. We have always really enjoyed eating together and going out to dinner and those kinds of things. And it was like, are we even going to get to do that anymore? You know, there's so many varying feelings that you don't even know you're going to have. And then you don't know, what am I supposed to do? Who do I see? Like, there's no pamphlets in the office that tells you, and now you need to do this, and then you need to do that, and this is the test you get, and that's the one you don't need, and blah, 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 blah. You are just so consumed and overwhelmed. I think one of the hardest things is the grief. Like, you know your life is going to be different. You know this is going to suck. You know this is not going to be easy. You know this is not going to be fun. You know it's going to cost a lot of money. I mean, oh my God. And then you have this person, if you're not the caregiver, they're feeling all of these kinds of things. Caregivers are feeling all those things. But then the cancer patient feels very isolated, like, oh, well, yeah, it's easy for you to say or easy for you to do because you're not the one who has it. I've seen a lot of cancer patients just get really pissed off, and they just, they feel alone. And no matter how many people say, I'm here for you, I care, all these kinds of things, I mean, that's great, and keep doing those things. But cancer patients are very overwhelmed. So I want to say that I got a bachelor's degree in psychology. That was one of my first degrees. And I really wanted to go into genetic counseling for women who were pregnant and found out there was some kind of chromosomal genetic wonky thing going on, anomaly. And so I got this degree, and I realized sometimes people want help, sometimes they don't. Some people, they just want to vent. Other people just want to complain. Everybody's got their own journey. I think it's important for people to look into support groups. When my brother Mike died of alcoholism, I wish I had gone to Al-Anon. If anything, it lets you know you're not isolated and you're not alone. About a year ago, so 2023, I got certified through the International Association of Therapists, and I have a PhD in Christian psychology, just because there's so many varying aspects to our emotions and the things that we do and think, based on faith, based on where we grew up, how we grew up, our culture, our society, all these different things that contribute to our emotions. And people need help. Nobody needs to feel alone. I know you're going to feel alone, but do something proactive about it. So, for example, with Regina, I got her a guided, I'm smiling for a reason. I got her a guided meditation series through Amazon, so that when she went to bed at night, she could just simply put on her phone, listen to her little, meditation. So the guy comes on and he's got the voice. Everything is going to be okay. I want you to take a deep breath. That is supposed to be soothing and calming. She was like, get this guy out of my face. She was just like, no. I have a friend who really gets healing from those kinds of things. Okay, that's my point. If you try something, do something. If it drives you nuts and you're ready to throw your phone through the window, then don't do that. If it's reading, read positive things. If it's singing, sing. I got Regina lots of music, and at nighttime, we're huge fans of CeCe Winan. So at nighttime, she would play CeCe Winan's Believe For It album, and it's very encouraging, very positive, very uplifting. She drew pictures. Regina's an artist, and she drew these little, like stick figures or whatever, just not very big, on a piece of paper. Like one had, arms like this, and it said, I am healthy. One said, I am strong. I am brave. And she cut these little stick figure thingies out, and she taped them on her closet door. And so every morning when she would wake up, she'd take her time, and then she would look at these little stick figure thingies on her closet, and she would say it. I'm strong. I'm healed. I'm whole. I'm brave. I'm okay. She would say all these different things. Regina is somebody who has an abundance of faith. And so I went online for her and I looked up lots and lots and lots and lots of scriptures that dealt with peace and healing. And then I printed them out in different colors, and then I posted them all over the house. So everywhere that she went, she saw, just these various sayings that were all about health and healing. If you're somebody who exercises, I encourage you to exercise. If you're open to yoga, I encourage you to try yoga. Regina tried chair yoga for seniors. She said, this is stupid. And I said, well, it's not stupid to other people. So do you hear what I'm saying? I went online to Facebook and looked for some support groups for colorectal cancer. Now, for me personally, as the caregiver and the best friend, it was very therapeutic and helpful for me to see people writing about all of the horrific things that come along with colon and rectal cancer. No one cared how bad it sounded. I needed the truth. I need to know, what about this? What about that? What about this? What about that? I began reading some of those things to Regina, and she was like, no, 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 no. I don't even want to know that. She felt like her skin was crawling. It helped me. The point is, please do something that will be beneficial for you. I have a beautiful niece who does Reiki, and there are lots of avenues to healing. So I'm not saying do this or that. I'm saying there are a lot of different things that you can do. You can even book an appointment with me for an hour and we can talk. There are lots of things that you can do to help your mind, because keep in mind, your mind is listening to you. Think about that. Your mind is listening to you. Your body is listening. So everything that we think affects our physical body. It's very, 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 very important to get your emotions in check, and don't dismiss yourself. Do not dismiss yourself. If you need counseling, get it. If it's just going outside for 10 minutes and being quiet. If you think about 20 seconds, I do this for myself, 20 seconds of silence to just "20 seconds is long. You wouldn't know it, but it is. So I encourage you to practice. Again, anything. Please take care of you. You are important. You are needed. You are brave. You are strong. You are all of those things. And if you need somebody to remind you, email me, talk to me. But there are so many different avenues that you can pursue. If you need extra resources, if you need help on where to start, let me know. Music is very healing. Reading books. Keep your mind occupied on positive, even though I understand that that is very, very difficult to do at times. But I do want to emphasize the need for taking care of your mind and your emotions as well as your body. Welcome to Blasts of Information. Talk about overwhelming. Yes. Oh my gosh. I mentioned this. When there is a cancer diagnosis, everybody comes at you. Do this, do that, don't do this, don't do that, blah, 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 blah. Let's start this. Oh my God, you got to do this. Oh my gosh, you have to blah. Now, as I mentioned prior, 9 times out of 10, that type of blasting occurs because people care. And lots of people want the best for you. I've had clients who are like, I swear to God, if you tell me one more thing, and I'm like, but there are things you need to know. So it's important too. And that's why I'm hoping this video will reach a lot of people and just save time, because I understand once you get these blasts of information and everybody's telling you, do this, do that, don't do this, don't, blah, 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 then you get confused. You don't know what to do, who to listen to, where to go. So when it comes to blasts of information, what I encourage people to do initially, unless it's too late, but that's okay, don't listen to everybody. There's nothing wrong with saying, don't say a whole lot to me just yet. Let me make a list. You can make a list. Okay, what are your options? Dink, dink, dink. Write it down. When people tell you things, think about whether or not that feels good. Do you resonate with it? Did it sound about right? Or does it sound cuckoo? Does it scare you? All those kinds of things. Let me start by saying the number one piece of information you need beyond anything anyone could ever tell you. The minute you are told you have cancer, you need to find out what genetic mutations that cancer has. Don't listen to anything until you've got that. There are numerous tests now created specifically for this, okay? My favorite is called NGS, Next Generation Sequencing. It will say exactly what genetic mutations that cancer has. Yes, I'm repeating myself for good reason. If you don't know what genetic mutation that cancer has, how do you really know to treat it? So back in the day, we've been told chemo, 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 chemo. Now, if you only understand chemotherapy for cancer care, I want you to dive into integrative health. You can read this book. Oh, you can't even see it there. That book. I'm not trying to get you to buy my book. What I'm trying to get you to understand is that chemotherapy, most doctors will tell you, do chemo, do chemo, do chemo. There are ample reports, and this is all in my books, but chemotherapy, first of all, is made from mustard gas. Look it up. I'm not kidding. Mustard gas causes cancer. There are numerous metals in chemotherapy, palladium, iridium, palladium. There are so many, and all of these particular metals, if you research them, they are highly toxic. It literally says no biological use. We are biological people, and yet that's what they pour into us. So prior to the 1900s, our medical system was based on botanical medicine. If you've ever seen the TV show Outlander, I always think about that because the main character, Claire, travels back in time. She's a medical doctor. She travels back in time, and all she's got are these plants and herbs. She's like, what am I supposed to do with this? But she understood some of that. That's all we had. I mean, we didn't have medical technology, and thank God for medical technology, but we didn't have those things. So all we had were plants. Well, the founding fathers in that era, so around 1765, that time frame, if somebody was interested in the medical field, they either had to train under a mentor in Europe, Western Europe, or they had botanical herbal medicine. And then the first medical school in the United States was at University of Penn in 1765, and they decided that they were going to bring in, it was a 2-year program, chemistry, botany, surgical techniques, midwifery, anatomy, physiology, but they also didn't know, right, back then, what we know now about cells and DNA and all those kinds of things. And so they had limited knowledge. Well, in the late 1800s, there was a gentleman by the name of Dr. William Coley, and he had cancer patients, and he decided to, as an experiment, to inject bacteria into his patients to see if it would stimulate an immune response and have their immune system kick in and try to get rid of this bacteria. It worked. Mostly speaking, it worked. And many of the up-and-coming doctors, oh, you're stupid, you're a quack, you're a whack, you're this, you're that, and they just dismissed him. It wasn't until the 1950s that his daughter actually found his notes and his work and those kinds of things. She opened a center for research, which today we call the National Cancer Research Institute. And they are doing massive things with immunotherapy. I love them. Okay, I love them. Anyway, back to the early 1900s when we had this botanical medicine, and now these doctors are learning lots of things. Mr. John D. Rockefeller, who was, the United States' first billionaire, and he was a monopolist. He owned everything and all the oils and that kind of stuff. He and his buddy, Andrew Carnegie, hired a man named Mr. Flexner. Lots of medical doctors like to dispute this, but it's written in so many different books, articles, journals, and magazines that you cannot dispute this. Anyway, they hired Mr. Flexner to go around the country and look at all the medical schools. And he did. And he came back and he wrote a report. It's called the Flexner Report. Please feel free to look that up. He was told to write this report that stated all medical school curriculum needed to be changed in the United States. They closed numerous medical schools. They got rid of all integrative medicine and holistic healthcare with plants and herbs and those kinds of things. And Rockefeller had a new slogan for medicine, and it was a pill for an ill. And that's where we started getting our synthetic medicine that was petroleum based, and he owned all of it. In 1913, John Rockefeller, D. Rockefeller, founded the American Cancer Society. So while I appreciate the do's and the don'ts and the blast of information and the, oh my God, and whatever, we need to know the truth before we make any decisions. And the truth is, now, at this day and age, we have a next generation sequencing test. We have a biomarker test, simple blood test, and we have liquid biopsies. Now, I recently spoke to a cancer patient who said, what the hell is a liquid biopsy? And I said, well, when you go to get a biopsy of something, they do a needle and they stick it into the tumor or whatever. They do the pathology, right? They pull it out. They do the pathology on it. They look at the cells under slides to find out exactly what kind of cancer, whatever. Some people believe that causes cancer to spread because of the air hitting it, and you're disrupting a tumor that might be enclosed. That's called tumor seeding. I'm back and forth on that because I am not just Western medicine. I am not just integrative medicine. I'm both, the best of the both. So I don't think it's the end of the world. However, You can get a liquid biopsy. You don't have to be stuck with a bunch of needles. You don't have to go under anesthesia and have this done. It's a simple blood draw in your arm. It can be done. You can demand a liquid biopsy. Please tell any physician you see, I'm not doing anything until I have either a liquid biopsy and biomarkers, or I've got a next generation sequencing test. I want to know what genetic mutations. If you get pushback, I am here to tell you right now, liquid biopsy and biomarkers, you can go to any Quest lab or LabCorp without a doctor's script and order it and get it done yourself. Yes, you're going to pay out of pocket, but yes, you're going to save your life. It's probably worth it. So I will say I have not experienced many doctors coming against that. I have seen a few. You don't need that. Yes, you do. You don't need it. Yes, you do. Yeah, but they don't. Yes, you do. Yes, you do. Yes, I get passionate about this topic because I want to save people's lives. So don't listen to everybody. Don't get overwhelmed. It's okay. It's okay. We're going to do one thing at a time. Don't settle for the first doctor you see. You need 2, 3, up to 4 or 5 opinions. Do not hesitate to do that. Do get a biomarker. Do get a liquid biopsy. Do get a next generation sequencing. You have to know what genetic mutation that cancer has before you do anything. When Regina, we refused chemo and radiation, and it's a very long story, which if someone wants to hear it, I'll do it. But all we were told was chemo, 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 chemo. I am going to highly encourage you to run to the nearest university hospital in your state or in your area. They are allowed to do things that small facilities are not. They are given more permission to do things that smaller facilities and HMOs legally are not allowed to do based on their protocol, their legalities, and their financial status. It is what it is. Medicine is a business. We all know it. There's no use in fighting it or getting angry with it. It is what it is. But there are loopholes. So University of Washington is where we ran. When we got to the University of Washington, the first thing the oncologist said is, chemo won't even work on your cancer. Thank you. You don't need chemo. Chemo's not going to work. Blah, 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 blah. You've got this mutation and that mutation. Nobody had listened to me. I wrote about this in my book. I kept telling these oncologists, she doesn't need this. She doesn't need that. What she needs is blah, blah, blah. She's got this mutation and that mutation. Nobody would listen to us. They don't make money. Let me repeat that. Numerous facilities profit more money off of chemotherapy than they do other treatments. So, with that being said, I recommend, I'm never telling anybody what to do, and you can do whatever you feel is best, but I think it's very important that you run to the nearest university of whatever near you. I believe MD Anderson in Texas is great. Memorial Sloan in New York. Boston has a great one. Chicago has some great ones. Their City of Hope in California. UW, Fred Hutchinson, Seattle, my all-time favorite. Please consider going to some of the larger facilities, okay? If you need help, contact me, because these places do have financial aid. There are resources. I know somebody who does nothing but give cancer patients financial aid resources here in Washington State. There are numerous programs. Every facility that you go to, ask for financial aid. I don't care what insurance you've got or what your income is. Some of them will reduce your bills even if you make 80 and 90 grand a year. You don't know unless you ask. When I did that, Regina's treatment just for the medicine was $27,000 a month, which didn't cover nurses, IVs, supplies, plus the natural protocols that I had her on. The manufacturers of these newest, latest, greatest immunotherapy drugs and targeted treatment drugs, precise medicine, they have programs called compassionate care. Regina paid $0 for her immunotherapy. $0. I paid a lot for the natural. $0. So, with all that being said, you've been informed. Those are options. I appreciate you bearing with me. Again, I get very passionate about this topic, but please know it really is just because I'm really wanting to help save your life. Okay. Bye for now. Hi again. Let's talk about integrative medicine. It's my favorite. So when I was going through all of this with Regina and I was doing some research, I would work all day as a professor of health sciences, and I also teach law and ethics. So I was looking at healthcare policies and all these different avenues and, loopholes and things that I could find for her. But I started thinking, and I have all this in my books, when we're growing up, we hear, eat your dark green leafy vegetables. And I kept thinking, why? I mean, oh, Doritos are bad for you. Why? What's in a vegetable, not corn, not potatoes, but what's in a dark vegetable that's better than blah, blah. So it has to do with all the chemical properties and everything, which I think pretty much everybody understands that. But, dark green leafy vegetables, the chemical properties in them not only boost your immune system, they help fight cancer. So we have integrative medicine, which means, like I said before, taking the best of Western medicine and the best of Eastern and natural medicine and combining those. You're integrating lots of things into your protocol that you need for you specifically, not based on what everybody else is doing. So that can include massage, acupuncture, chiropractic care, the meditation when we talked about emotions and those kinds of things, support groups, counseling, prayer, music therapy, equine therapy, swimming, all these things, right, feed into your body in a positive manner. When Regina was diagnosed with cancer, she lost 60 pounds, I lost 40. I still have a long ways to go. I'm meaning my whole psyche. I've never been a skinny little thing. I don't know that I ever will be. I don't really care about that. I just want to be careful and make better choices. I'm not a huge fan of exercise. I admit that. So then I think, what can I do to just move? My friend said, just move every day, just move. So I do yard work, I cut trees, I'll take a small walk with the dog, all these different things. Now, the other aspect of integrative health is going back to the 17 and early 1800s when we had herbs and plants and supplements. Lots of people know about fish oil. They tell us all different kinds of things all the time. Milk is good for you, milk is bad for you. This is good for you, that is bad for you. You should take fish oil for your heart. Fish oil is bad for you because it's got mercury and lead. And oh my gosh, it goes on and on and on. Can anybody relate? So I sat down and started studying. And I would do this at night after Regina would go to bed. And I have copious notes. But again, I put all these in my books because I wanted people to have an easy way to get this information to them. Not a lot of people want to research or understand how to research, and I get that. People don't usually have the time. I've put in probably, honestly, about 1,000 hours into just supplements that help kill cancer and yet boost your immune system. So if you look at immunotherapy targets the bad cells using your own immune system, builds your immune system, and retrains your immune system how to spot the bad cells, so that even moving into the future, if one of the bad cells starts going wonky, it's been retrained. You're bad, I'm going to eat you up. Blow up the shield, right? Take that shield right off. So how do we do that naturally? Why is it bad to use, say, immunotherapy for cancer treatments and natural immunotherapy? Why can't we do that? That's what we did with Regina. So with that being said, most people don't want to hear this. Most people will argue with you, but numerous cancers stem from, how do I say this? Undiagnosed parasites in the body. No one wants to hear that. I know it's totally gross, but not all cancers are from parasites. I am not implying that whatsoever, but many are. In integrative medicine, there's a thing called repurposing medicine. Repurposing medicine means you could take charcoal, and instead of using it for this, you can also use it for that. The newest popular one is Ozempic for diabetes, and it helps people. I was going to go into the mechanism of it. It not only lowers blood sugar, but it helps people lose weight. So it's kind of repurposed for weight loss. So there's a medication that I always say the word wrong too. Anthelmintic, which is a deworming medicine. That comes in the names of fenbendazole, mebendazole, abendazole. Lots of people are selling fenbendazole online and making millions of dollars and millions of dollars. I don't understand why it would cost that much. So I started researching, because there are lots of people that say, oh, it doesn't do anything. Oh, it's bad for you. And other people will say, oh, it's great. It's wonderful. The truth is, deworming medicines go to the inside of a cell. It's called, the inside of those cancer cells have microtubules, and fenbendazole, mebendazole, abendazole. Meben and aben are for human consumption. Fenben is for animal consumption. They're the exact same things, but the labels will show you this is intended for animal use, this is intended for human use. Fenbendazoles, anthelmintics, go into the middle of those microtubules and blow them up. Simple version, no, this is not scientific. The other thing that these anti-parasitic medicines do, you have a cell here. Cancer feeds off of sugar. Cancer fuels itself from glucose. It's called the Warburg effect. So fenbendazole also stops the uptake of sugar into cancer cells. It's very effective. Now, while lots of people like to sell fenbendazole for cancer patients, again, you should never pay lots and lots and lots of money for this. There are much more inexpensive ways to get it. I'll just say that. If you can find an integrative health practitioner, such as myself, usually they can also prescribe the mebendazole and abendazole. Contact me if you want more information on that. So while people say it doesn't work, I believe it does, 1,000%. I had Regina on it. The thing is, a lot of people who sell fenbendazole are not medical professionals. I am. So you have to protect your liver. Now, it's not often that people would have liver side effects by taking an anti-worming medicine, but it can. And people who sell it tell people start with 100 milligrams, go to 200, go to 300, 400, 500, up to 2,000. And I mean, if your body can handle that, that's a personal choice. But I'm a less is more kind of girl. Definitely start on the low side, but you have to protect your liver. So there are a few things that you can use, such as Tudka, or like I have a liver detox with milk thistle, Tudka, all different kinds of things in it. You have to protect your liver. Less is more. Don't just go randomly out there, okay? If you want my little protocol that's just a suggestion, email me, I'll get it to you. If you want a consultation with me, email me, we'll get you a consultation. My website, you can make appointments that way too. Anyway, all of that to say, fenbendazole is an option. Berberine is another natural herb that is proven to help fight cancer. It depends on which type of cancer you have, which supplements I usually recommend for people with integrative health. I have yet to recommend anybody just do botanical medicine, but that is your choice, absolutely. But I always start out slow, but I have numerous things. CBD, at nighttime, CBD is great, and 25, 50 milligrams. And I talk about it in my book. I hate to keep saying that, but there's so many different ways that CBD fights cancer. I'm not talking about THC that makes you loopy and high unless you want to get loopy and high and then just knock yourself out. But turmeric, I have like turmeric with quercetin, because turmeric also helps destroy cancer cells. Quercetin boosts your immune system. I had Regina on beetroot, cranberry, lots of different things. So I spent hours and hours and hours researching what herbs, what plants, how much, how this, how, you know. So I had Regina on this protocol. Before Regina even got to Fred Hutchinson in Seattle, I had her on a protocol for 6 weeks, just a natural protocol. And in that 6 weeks, her tumor went from 10 centimeters to 1. I'm not kidding. 10 centimeters to 1, just using my little protocol. I was like, and that's a whole nother story, and it's very cool. After that, Regina was able to get a brand new immunotherapy called Jemperli. She had the genetic mutations that Jemperli was made for. It's it's 2 years old now, but the point of that is there are things you can do that are natural to get yourself going until you get to the right doctor. I'm an integrative health practitioner. I'm also a board certified patient advocate. I also have a master's in law. That means I can be hired. I can train people. I can speak for people. I can write letters. I can find the right facility, the right doctor, the people who will do the tests that you need to get you then the medications that you need, right? I don't advocate for chemo at all. I will never apologize for that. Now that I know what's in chemo, it disgusts me to know that anybody would still prescribe this. I have a client who we finally got the genetic mutation. I was in on some of her doctor's appointments via Zoom. My client asked this oncologist, if this were you, what would you do? The oncologist said, I would do chemo. I don't believe that for 2 seconds. The mutation, the genetic mutation that my client has, you can go to Google. Does chemo work with this particular mutation? It straight up says no. Chemo is ineffective. Chemo will not work. Chemo, blah, blah. Black and white. And an oncologist is saying, do chemo, do chemo. Oncologists are the only specialists that are allowed to receive bonuses and markups. And I'm going to leave it at that. So, why am I taking my time to say these kinds of things? I want you to live. I want you to look into integrative medicine. If you want to buy my book, buy my book. If you don't, that's cool. I make $4 off of each book. I need people to have information. You can't afford a book, I'll send you a book. I don't even care. Because I had Regina on all of these supplements, and it cost me a lot. She's on very limited Social Security income. I'm a teacher, so of course I don't make a whole lot, but by the grace of God, I'm fine. Anyway, all of that to say, I thought, you know what? Where's all this stuff coming from? I did a year-long study. Almost every supplement on the major shopping websites, they come from China. A lot of the bottles, I've got all the proof. A lot of the bottles are like, people here can buy them for like $1 and then sell them for like $40. And I was pretty disgusted by that. And I was mad, hopping mad. And then I was like, how is this fair? Like, is this even healthy? Like, if it's not organic, they can use pesticides. If it says organic, you can be guaranteed there's no pesticides in it, at least from my knowledge up to this point. So what I did is I took a year of studying, again, copious notes, and I started my own supplement company for a very selfish reason, because I thought, you know what? I'm not getting ripped off anymore. I can't afford all this stuff. Like, why should it be so hard for somebody to be able to live, right? And physically. And so I found a manufacturer in Utah, and I went to them and said, can I pick certain stuff? Can I make certain stuff? Because now I know what everybody needs, right? And they're like, yeah. So I was like, okay, I want this, and I want this, and I want that, and blah, 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 blah. Can I do it on demand? So like, I don't have to have, you know, an office full of like 50,000 bottles and whatever. And they said, yeah. So I did it so that I could buy my supplements for Regina and myself at a wholesale cost. I'm being honest, totally selfish. So that went on for a couple months. And then I was like, you know, I bet my daughter could use a good discount. You know, I bet my son-in-law could use a good discount. What about all these cancer patients? Oh my gosh, they're all spending, like, it, right? It's like it dawned on me. I didn't realize at the time that there was a whole bigger plan in the universe of help people, help people, help people. So I started this supplement company. You're welcome to look at it, but I'm here to tell you right now, everything's organic, manufactured in the US. Like I said, I literally make $4 to $7 a sale, and most of that is getting eaten up in taxes. I don't need to be a millionaire. I need people to live. I need people to know the truth. I need people to be able to get the things that they need. You can do integrative medicine. You can do all natural at first if you want. Please, please. But please look into integrative health. Please let me help you. Please know what you're dealing with, because then you'll know which type of supplements to get. You can email me. You can look in the back of my book for the specifics that I have in there. Each cancer has some different needs too. So for example, hormone-driven cancers like breast cancer, prostate, no hormones. Melatonin is really good at combating GI, stomach, colon cancers, things like that. But melatonin is also a hormone, so it's usually not suggested for those with breast cancer, prostate cancer, endometrial, those kinds of things. So I encourage you to look into integrative medicine. Start at the beginning. Get a liquid biopsy. Get a next generation sequencing test. Then look into Western medicine. but understand integrative medicine, because I think that it is a whole approach. You're not treating just a symptom or just cancer. You're treating all of you, because the goal is total healing, right? You want total healing. So here we are, kind of at the end. I want you to know, if you're listening to this, this is about you. It's about you. This is about you. And this is about doing what's best for you and what you need to do. So please consider all of the things that I've suggested. You can always go back to previous slides and re-listen. I do have 2 books. You don't have to buy them. If you want one, you can't afford it, like I said, email me. I'll totally ship it to you. I have a ton of resources in my books. The first book, You Can Stop Cancer, includes not only Regina's journey, but all of the spiritual things that we encountered during that time. It talks a lot about the emotional aspects and support groups and all those kinds of things, as well as everything else. The second book is titled Natural Protocols That Kill Cancer and the Scientific Proof Behind It. If you decide that's something you want to do, I encourage you to take notes, take it with you to your doctors. You need to have the genetic mutations found first. You need to have that done first. I cannot emphasize this enough. Please, please, please get those tests done. If you need help, email me, contact me. I can help you. If you need me to research what doctor to go to, where to find the test, what facility, helping make appointments, finding out about financial aid, any of those kinds of things, let me know. If you are interested in supplements and integrative medicine, I can tell you exactly what to get, again, listed in the book, but if you just want me to email you, I will. You don't have to buy things from me. I am going to say you're going to find my prices are cheaper than most places. However, I want you to compare labels, compare prices. I either handpicked or created all of these myself based on what everybody needs. They are FDA approved. They are organic. But never, ever spend more than you need to, okay? I am going to add some terminology on the next slide that you can use as a reference as well. You can download it, you can print it, you can do whatever you want. No matter what type of cancer diagnosis there is, you need the genetic mutations found out first. I cannot emphasize, I know you're probably ready to slap me, but you really need to know that so that you know how to treat it. 28 of the most common cancers, they now know, Cancer Research Institute, non-compliant with chemo does no good. All it does is pour chemicals into your body and it kills you super fast. If you are somebody who has already found yourself in a situation of doing chemo, get a hold of me, or I'm going to have more slides, more videos on detoxing and getting heavy metals out of your system. That is something that you can do. I can help. I'm on Facebook, True Biohealing LLC. I'll put all the links in here and that kind of stuff. I encourage you to hang in there, okay? If you need help, ask for help. If you want advice, get advice. Please don't go with the first doctor you speak with, please. unless that doctor says, yep, integrative medicine, immunotherapy, or targeted treatments, or precision medicine. Those are the buzzwords you want to hear. If you are told, well, you can do chemo and radiation, we'll get you in tomorrow, just please, 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 please find out exactly what the mutations are, and then you can go from there. For those of you who are praying people, I want you to know that I'm praying every single night. I really want people to live. For those of you who are like, don't care, I'm sending you all kinds of positive juju. And I mean that with every fiber in me. I just want to help people. I want you to know that you're not alone. I have a support group online. I'll keep making videos. I'll keep doing whatever it is I can think of to do to help people. But for now, be informed, know your options, and know that I'm out here. And if you need me, let me know. And I would love to know if this video was helpful or not. I hope so. It was definitely, like I said, I'm just keeping it on the down low, kind of chill. Nothing scientific. I can do all kinds of scientific things if people want, but that's not what this was about. So congratulations for getting through this. It's going to be okay. And I want to encourage you and support you and know that you're not alone and you have options.